Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. We are here again with another video from Pakistan Cystic Fibrosis Support Network. This session is little different and much more interesting. It's a question answer session, and as we all know that asking questions lead us to a better stage of knowledge. But today the questions are from a very curious 9 years old CF child, Sarah Umer from Jeddah, who has embraced her condition very positively and living a wonderful and beautiful life. And she will be asking questions from Dr. Ali Akbar from Birmingham, UK. So here Sarah is going to start.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Nice to see you, Sarah, and I understand that you have some questions for me.
Yes, some are very tough.
Well, I'll try my best to answer them. Inshallah.
Okay. Inshallah. So the first question is about my gender. So do the girls like me have CF more or the boys?
No, the boys are just as likely to have CF as girls. So there is no difference in gender at all.
Oh, I did not know that. That's a good question, really.
Thank you.
Okay. You're welcome. Okay, so this one is kind of related to my mom. So when my sister gets a cold, she's like, okay, let me give you a medicine to check her fever and like that. But when I get a cold, she kind of, I could say freak out. She says, okay, and she takes me to the hospital and everything. Is it because of my CF or does she love me more?
I think it is both. She loves you and you have CF, and therefore she wants to make sure that your CF is not going to make you any worse than your sister when you have a cold. Because we know the CF children are more likely to get infections. So first of all, your mama wants you to be protected from any infections. And when you do have an infection, she wants to make sure that you're not going to get any bad, because we know the CF lungs are affected worse than the normal people without cystic fibrosis. So we want to make sure we get you treated with antibiotics and physio to get rid of all that phlegm and mucus that is produced more in CF patients and causes more problem than the children who don't have cystic fibrosis. So I think this is to make sure that your lungs remain in good condition and they are not damaged by any viruses, which in other people it'll be okay. But in CF, we want to make sure that they don't attack your lungs any worse than the other people. So she loves you, and that's why she wants to do more care for you and want to give you the antibiotics or take you to hospital as needed.
Okay, that was a really good answer, and I did not know that. Okay, this one is a little tricky.
Okay.
Because I'll need your suggestion and your answer.
Okay.
Okay. So every time we go to the furniture shop, my mom always says, she can, like, whenever we go to the carpet section, she always says, Sarah, you can't buy this carpet. Sarah, you can't buy this carpet. I really want a carpet because it's so cozy and colorful. It makes your room look nice. Can you please tell me why?
So you want the carpet and your mummy doesn't let you have one. Is that what you're trying to say?
Yes, she says the doctor doesn't allow you and it's not good for you.
Okay, so the reason is that the carpet, as compared with wooden floors or other floors, they, like you said, they are fluffy things, like the fluffy toys and like our bedding, which is sort of fluffy as well to some extent. And there are little bugs called dust mites, and they live in these fluffy carpets and toys. And there are some children who are allergic to those, and that causes them to have runny nose or sneezing, or sometimes it can make some children's asthma worse if they have asthma. And we know that the children with cystic fibrosis are more prone to have asthma symptoms. So I think your mom is probably right in that sense that if you did have a carpet which is a little bit fluffy and allows the dust to accumulate, and then the dust mites can live in it, it can make your symptoms worse. And I think that is why she's probably saying it would be better not to have one, although it may look nice, but at the other hand, your health is more important than a nice looking floor.
Okay. Can you also like tell me any type of carpet that many dust mites can't get into? Any carpet so we can have in our room?
So all carpets with fluffy surface will allow the dust to sit in there, which you can't even see. Even some vacuum cleaners, they may not be able to clear it, although they claim they can, but they may not be able to. And it's sometimes very difficult to keep the carpet clean all the time. So I think a wooden carpet will be a lovely one.
Hey, thank you. Okay. Now I have one related to my school and my class.
Okay.
Okay. Every time I go to my class, I notice, why am I the shortest one?
Okay. So people are all different in their height. So even people who do not have cystic fibrosis, some are shorter and some are taller. So we all differ in our height. We all differ in the way we look, like how well nourished we are, or how fat we are, how slim we are. So we all are different in that sense. And looking different, being different is nothing serious and nothing abnormal. But in cystic fibrosis, one particular thing we need to be careful about is that we know that cystic fibrosis patients, they don't put weight on very much or as well as the others. And weight is very much related to a person's height and growth. So it is very important, therefore, to make sure that we eat healthy food, plenty of food, to give us lots of calories, to put weight on, and to grow. And that is why it is important to do all the physio and treat the infections, like you said earlier as well, virus infection or so, to make sure that they do not cause your calories to be burnt, but you have enough food to grow as well. And we know that CF patients sometimes are a little bit behind the normal children because their nutrition and weight gain is not so good. And that's why their height is a little bit shorter as well. So if you can work on your weight gain, that would be excellent.
Okay, thank you so much. And now I'm going to talk about my allergies. I want to know if it's related to my CF or just something I have. Because when there's a dust storm here, my mom always says, Sarah, remember, don't go out. And I say, why, Mama, why? She says, because you're allergic to dust. Are my allergies because of my CF or just normal?
Okay. Well, we talked about the dust in the carpets. So it's the same sort of thing. If you go outside, when you have the pollution outside, when it's smoky and dusty, and you have the sandstorms in Jeddah and the areas, it's very difficult to breathe the air which is polluted with all the dust and the smoke, and it makes anybody's breathing worse. But when you have cystic fibrosis and lung problem, it can make it even worse for you. So yes, dusty atmosphere, smoky atmosphere, these are not good for anybody, never mind those who may have cystic fibrosis or lung problems. But allergies themselves are not more commoner in CF patients. But as I said earlier, CF patients are more prone to have asthma, and dust and house dust they can make the asthma worse. So yes, your symptoms and breathing can be worse when it is dusty or smoky. So yes, it is best to avoid those conditions.
Okay. This one is related to you.
Oh, fine related to me.
Yeah. Okay, if you were a CF patient, what would be the best physiotherapy for you? An a cappella, flutter, or the hand physiotherapy manual one, or trampoline jumping, vest, or running or skipping?
Actually, I'm very impressed with the knowledge that you have about different sorts of physiotherapies. I'm really, really pleased to know that. If I was a cystic fibrosis, then you see, when I was a baby, or when, long time ago, I really wouldn't know what is the best for me, and I wouldn't really be old enough to be able to use the a cappella and some of those devices, or trampoline, or jump. So I am really, as a baby, dependent on my mummy and daddy to do the percussion things, tapping the chest to move those cushions to get them out. But as I get older, like a younger person, then I may be able to do some of those things myself as well. The purpose of physiotherapy is to clear the chest. So whatever procedure, whatever technique, whatever device one is able to use that clears their lungs is the best for them. So at different age, different technique, different play will be better. And this is where the role of the physiotherapist is very important, that they can actually assess the child, look at their age, see if they can use a device. And when they do use that device or do that activity, are they clearing the chest? So if, for example, doing the trampoline, actually move the cushions, bring them up, and they are okay, and you are otherwise healthy and well, that is excellent, because physical exercise, skipping and trampoline, etc., that also strengthens your bones and muscles, as well as clearing the cushions. But the purpose is to clear the lungs of all that mucus. So whatever activity, whatever device, whatever technique you want to do, you need to make sure that your lungs are clearing after that. So long as that is achieved, then that is good.
Okay, well, my favorite one is definitely the trampoline.
And that is good. That is very good. But you need to make sure that using trampoline is actually bringing your phlegm up and you are able to cough it out. And if that is good, then that is fine for you.
Okay, now I'm gonna relate it to myself. So I'm actually a very, very, very picky eater. So do all my other CF friends also, are they also picky eaters like me?
Yes, it is a problem in lots of people who have cystic fibrosis. Because people with cystic fibrosis may have cough, and with cough they can sometimes vomit, or they may have chest infection, which can cause the coughing and vomiting, and that can also cause their tummy aches and upset as well. And also we know, and I think you know as well, because you take creon for your food to digest it, and if there is not enough creon, or there's not balance between the fats that you take and the creon you take, you can get tummy aches as well that make people upset as well. So they actually may go off food because they think, oh, it may make them vomit, or they may get tummy ache, or the infection also makes them to have poor appetite. So it's not always the child's or the person's fault that they don't eat, but it's because of the other things as well. And we doctors, we need to make sure that we can keep and advise you on keeping your chest clear, and we can make sure that you can have all the necessary treatment and medicines to make you put weight on and stop you from being sick. And therefore that will say, right, I can eat, I'm not going to be sick, I'm not going to get tummy ache, and therefore your appetite will get better. And as I said, some of those conditions can put children off because they may vomit and they get tummy ache, and they say, all right, I'll go off. But infections can also reduce your appetite. So it's not your fault, it's the other things. And that's why we want to make sure that we can look after you to keep you healthy and well in all different ways.
Okay. That's a really, really good answer. Now, you're welcome. Now I'm going to be talking about this pandemic, the corona.
Okay.
Okay. So, like now it's not good for children to go out usually, but I have to go to the hospital quite a lot of times. So every time I go to the hospital, my mom says, if it's really public, my mom says, wear 2 masks, wear gloves, like that. She's really worried for me. And like when my sister not too much, but when she goes to the hospital, she says, honey, don't forget to wear a mask and gloves. And she even she's not that worried for her, she's more for me. And she even said to my dad to buy the face shield, you know that one, to protect my eyes. And is it because I'm younger or what?
Okay, I think it is because your parents love you both, and because you are 2 different people, with you having the cystic fibrosis, they want to make sure that you are protected from infections, which sometimes the other people are not affected as badly. So they want to make sure that your eyes are protected with the shield, etc., because the coronavirus that you mentioned can only enter the body through the eyes, nose, or the mouth. And that's why it is important to protect those 3 areas. And when you go to the hospital, you don't know the person next to you or sitting next to you is having any problems with infection or not, or whether they may pass it on. So it is very, very important that you do protect yourself, that you don't go outside unnecessarily, only for your appointments that are needed to go to the hospital for. And whenever you go, you protect yourself. And this is, like I said, with viruses, because CF patients can have worse infection than the normal children. Coronavirus is the same. It can affect those children with cystic fibrosis worse than the normal people, and therefore your parents are wanting to make sure that you are looked after and protected when you go out.
Okay, thank you. And now my last and final question.
Okay.
This is a tough one.
Okay.
So, since I told you I've been to the hospital many times.
Yes.
Since they put so many bandages, tapes, injections, IVs through me, my hand has gotten so weird, the skin is peeling off and there's holes, marks, and I do not like it. Can you suggest something, and can you please suggest something to tell me how I can make my hands more beautiful again? Because my mom just says, just put lotion, just put lotion, just put lotion. But I need a better answer.
Oh, I'm not sure if I'm going to be able to give you a better answer than your mom, but I know that it is very important to wash your hands to make sure that you don't catch any infections from other people or other things that you may be touching. So hand washing is very important. And it shows me that you are being very, very careful with washing your hand. That's why your hands may be a bit dry. So when you have dry hands, the best thing you can do, this alcohol wipes, etc., that they use to disinfect, they can also dry your skin and make them dry. So the best thing is wash your hands, and then you can use the emulsifying or moisturizing creams as much as you want, because they are not medical ointments or creams, but they are moisturizing creams. And dryness with frequent washing can affect the skin, and that can cause the peeling as well. So I think your mommy is already doing the right things by suggesting that you need to use moisturizing creams as much as possible, and that is probably the right way. But you should still use your, you should wash your hands as frequently as possible.
Okay. And that's it. No more questions.
Thank you very much. You're most welcome. And if you have any question in the future, do write them down and we can have another session. I really enjoyed talking to you and answer your questions. And I hope that you got all your answers as well.
Yes, I did. And thank you very, 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 very much.
Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Ma salama.